You deliver the appliance to what you have predetermined is going to be an effective position. You have them tight, wear it for about a week, get comfortable, titrate to an effective position, and then do a follow-up study, make your decisions from there. Side effects, occlusal changes, tooth pain and discomfort, oral soft tissue pain discomfort, TMD jaw pain and discomfort. Occlusal changes, they are going to happen. They're documented. Why occlusal changes? Thickening of the posterior attachment of the TMJs that do not allow the condyle to fully seat, muscles of mastication change position, and tooth movement related to the appliance use. Changes in occlusion, non-return of the condyle to original position, and orthodontic movement of the teeth. Changes in dentition, they will mimic the changes of orthodontic treatment. You'll see spacing, you'll occasionally see root resorption, you'll see flaring. Remember, distal forces on the maxilla and anterior forces on the mandible. You'll see these problems aggravated, fewer teeth, and periodontal problems. Bottom line, all sleep appliances cause changes in overjet and occlusion. The exercises we'll review help mitigate that. You will have changes, which is more important. Someone being alive, being able to breathe and function, or some occlusal changes. Being alive is more important. The more you have to protrude them, the greater those effects will be. Bites will change. Life and health are more critical. Treatment of occlusal changes. AM exercises to reseat the jaw. They need to be a proper technique, proper duration. Cois appliance or an anterior jig to reseat the condyles. Have the patient verify occlusal, normal posterior occlusion at night before they go to sleep. So the repositioning exercises are done every morning. Just wash the appliance, immediately do the exercises. No delay, because people will forget and minimize the exercises. No delay, because the most immediate, they'll say, can I do them 2 hours later? No, they're not going to be as effective. If someone is not willing to wear an AM repositioner or do the exercises, don't treat that patient. You will have changes occurring you cannot treat. Okay, AM positioning exercises. Basically, it's a series of exercises in which you do three things. You're supporting the head, you're getting the arm horizontal, you're feeling the condyles push back into the joint, and you go from being able to speak 1, 2, 3, 4 to where you can't speak. All you're doing is trying to reseat the condyle to where it was. You've got to be careful. If you've got one of these undiagnosed joint problems, you can complicate the person's life. Not a nice thing to have happen or to do to someone, so you've got to be reasonable. People will automatically go to the thinker position for those AM seating positions, and it will not reseat. They're going to go like this, they're going to resist it, and the condyle's not getting reseated, nothing's happening. It's not the thinker position, it's getting that back. If you have someone not doing their AM exercises, they're going to develop an open posterior bite, and you're going to have to get them out of the appliance and doing the exercises to reseat. Appliances that they can bite into to reseat. There again, you're using some of these like a leaf gauge. You don't want to pop someone off the disc. Not a happy occurrence. AM positioner. Take a piece of mouth guard material, cut it into a 1-inch wide strip, have them bite in it in leaf gauge fashion. Not my favorite. I think you're doing better getting something like this AM positioner from AMI, Airway Management Industries. You mold it in hot water, they bite to place, and then you put them, it'll cool, it'll retain the position, it's got Kevlar. You have them bite into it fully for 20 minutes as they're getting ready in the morning. It'll seat them back to their original bite position without over-seating the condyle. Thermocryl, you can do the same thing in a minute, and a lot of people like that Thermocryl. You boil it, you form a mass, you do the same AM repositioner. I like this anterior jig. It's a Cois appliance with a slightly steeper rim that drives the condyle back to their original bite. So you're not over-seating. You can use a Cois appliance or some derivative thereof, so you've only got anterior contact and you're seating. The problem with some of the pieces there that the labs send out is it will it will superiorize the condyle, but at the position that the mandible's already forward, so you're not getting the occlusion settled. Occlusal changes can occur. You have to deal with them. Pain and discomfort on the teeth, why do they occur? Uneven pressure on the teeth or uneven pressure on the gingiva. Treatment, make sure your impressions are accurate, verify. We all know how to adjust a night guard, have some green spray occlude where something's hitting a tooth too hard, relieve it. Pain in jaw discomfort, inflammation in the joints, referred pain from the muscles of mastication. If you have capsulitis, over protrusion or moving someone forward too fast, or you've got excess vertical dimension, treatment, back off, retitrate slowly, verify midline, posterior support at the proper vertical dimension, stay a little further back, may limit your treatment, and do those AM exercises. Joint muscle discomfort, verify straightforward protrusion, constant midline, even bilateral occlusion, good posterior support. Do those AM exercises or bite into the appliance or you will have problems and the patient will have problems. Are we starting to notice a pattern here? Make sure those exercises are done. If muscle soreness or TMJ problems persist and you're not getting release of the muscles in the joints, again, the AM retrusive exercises, resistive exercises, open right, left to relax the lateral pterygoid and the other muscles, and hot soaks, both sides of the face, gentle opening exercises, 20 minutes a few times a day. Slow down your titrations, possibly revert and start over more slowly. Possible CPAP and as your alternative, or possibly wearing a daily orthotic. If they've got muscle pain, these are the usual things: exercises, hot soaks and stretch exercises, NSAIDs for the inflammation, soft diet. If they're clenching and grinding, remind them lips together, teeth apart. From this rule, do not depart. Muscle relaxant, Flexeril, don't like using it because it can worsen the OSA, but a half a tab often does it for people, and possibly 1/2 tab in the morning. That can make a lot of people sleepy because it's got a long clearance time. Robaxin has half the half-life, and tizanidine will decrease nocturnal bruxism as well, so it may be an effective medication. Muscle soreness, if they're clenching and grinding in the appliance, then sometimes you just go with a single anterior stop as a deprogrammer. You may have a bipod modification where I put just 2 positive stops in the cuspid position, so when they bite, they're not dislodging the appliance. You can also tripod anterior and at the molar areas. Miscellaneous issues, excess salivation, towel over the pillow, tell them they'll get used to it. If it's dry mouth, make sure that the appliances are not dislodging and you've got rubber bands on the appliances to hold the jaws together. Verify retention if the appliances are loose. Again, you want frictional retention, not overuse your clasp. If they're dreaming more, that's normal with sleep. Make sure they're not having REM disorder where they're not having the muscles go into atonia. And if you're still having problems, you may need to re-PSG. You can use these appliances either apart from but in combination with CPAP, or you can use the appliances that hold the CPAP, nasal pillows, or oral hose in place.